Okay, one question that we get very often from patients is whether fillers migrate over time. So I always answer this as a yes and no answer because there are a few factors that cause fillers to migrate when they shouldn't. Number one, it's about the technique and the injection or the placement of the filler at different layers of the skin or tissue. So let's say, for example, if we are doing at our laugh lines, there are a few different techniques. There's a direct injection or sometimes a cannula, which is a long blunt needle that is used for injection. I always believe that the injection technique that places the fillers deeper will cause the fillers to not migrate. But however, with a cannula, sometimes it's being placed too superficially, and due to facial movements like this, it pushes the filler and sometimes it causes it to migrate. Another thing is to use the right type of filler. So if you're using a filler that is softer, you're using a filler that is harder, it makes the results different as well. So let's say, for example, on our nose, if you're going to use a very soft filler, the pressure of our skin and over time causes the filler to be pressed down, and at the same time, softer fillers tend to absorb water and expand and look like it migrates over time. So the right type of filler is very important. Last but not least, like all injectables, we are not supposed to overdo them. So if we are going to overdo a filler, it will look like it migrates because there is just not enough space for excess filler in a certain area. So let's say, for example, our lips. If we're going to do more fillers than what we should do, it actually migrates upwards or downwards around the borders of the lips, and it looks like that filler has shifted. But actually it's because it has been overfilled. In order to not cause fillers to migrate or shift, there are a few things to take note of. Number one, of course, go to a doctor that is experienced, know what he or she is doing. And at the same time, over here in Mizu, we practice a bit more conservatively. So meaning, we try not to do too much at one go so that to avoid that from happening. Other than that, we also usually always use hyaluronic acid fillers so that if in any case it does shift or broadens, it can be reversible and dissolve away.